So we're going to look at the anatomy for the opposite side GP. So what you're looking for when you're placing topical is you're going to touch the distal lingual cusp of the second molar, and you're going to slide down the alveolar ridge to where the alveolar ridge and the palate meet. That's where you're going to place the topical for your opposite side GP. Now you physically have to hold the topical in place for 1 minute in order for it to be effective. If you just swipe topical on there and then let the patient start talking to you, the saliva will wash the topical away and it will not be as effective for the patient. So now my student has held the topical for 1 minute, and now she is going to switch out the topical for a dry cotton tip applicator. She's also going to pick up the syringe, big window down, and then she's going to flip it up so the big window is up. She's going to uncap the syringe, and she's going to park the syringe on what we call the hip. She's going to sit at the 8 o'clock position, and you're going to hold that like a syringe. Hold it like so that your thumb is on the end of the Q-tip. So put it between these two fingers and put your thumb on the end. There you go. So we're going to hold the thumb on the end of the Q-tip, and we're going to place our fingers on the patient's cheek for stability. Then we're going to advance the dry cotton tip applicator into the mouth, distal lingual cusp of the second molar to the palate, and then you're going to come distal just to where you're over the foramen, and you'll feel the cotton tip fall into the foramen. This is where you're going to put pressure anesthetic. So you want to put pressure on your thumb and hold that cotton tip applicator for 30 seconds until we see blanching of the tissue. So once you see blanching, you're ready to give your GP on the opposite side. So go ahead. We see blanching, and you're just going to follow the stick, okay? Follow the cotton tip applicator, and you can use the lip as kind of a fulcrum. And you're going to go about 1 millimeter above the Q-tip so that you don't touch the Q-tip, because we don't want to contaminate the end of the needle. And you want to watch that you don't slide down the back of her throat with your Q-tip. So that's why we want to really hold our position so we don't gag the patient. Okay, go ahead.
At my minimum penetration site.
I see, proceed.
Maximum depth and angulation.
I see, proceed.
Aspirating. Negative.
I see, proceed.
Depositing.
Okay, you can go ahead and lift
Okay.
off. And if you get a little bit of bleeding on the palate, like she did, just take your Q-tip and hold some pressure on the palate, and that should usually get the bleeding to stop. That tissue is very thin in that area, and so you can actually cause a little bit of bleeding sometimes. Okay, go ahead and get your